Hi, I'm Swapna from TheHealthSite.com. October is Breast Cancer Awareness Month. We're going to talk about breast cancer to Dr. Sumeet Shah, who is an oncosurgeon who's been practicing in Mumbai. He has also worked with Tata Memorial Hospital for 5 years before starting his own practice. He runs a hugely popular breast cancer website called Breast Cancer India and the Pink Initiative. You can know more about all these organizations in the description and click on those links below to find out more about that. I'm also going to talk to Ujwala Raje, who is a breast cancer survivor and has been in remission for 2 years now. The first thing that I want to ask you is that there is a huge increase in breast cancer cases in India, and what is it that people really need to be aware of when it comes to breast cancer?
We have seen a massive rise in the number of cases of breast cancer in India in both urban and rural areas combined. And the one thing which we come across as a doctor is that there is a lack of awareness. People are coming, more than half of them come in the later stages. And the reason is that a majority of them did not know the signs or symptoms of breast cancer. Had they known that, then they would have definitely come ahead. That is what we are trying to reach out to the people, you know. The earlier they come, the better the survival.
Doctor, what happens is a lot of women who are watching this video can also click and, in the photo gallery that we have created to look out for various symptoms like the changes in skin color or changes in the size of their breast or any change in their nipple or any discharge and those common symptoms. But how frequently should they do this breast self-exam, and when is it that they should go to a doctor?
Correct. I would like to divide the guidelines for a normal person into two halves. One is for those women who are less than 40 years of age and the other for those who are above 40. For below 40, there are two things which a lady should keep in mind. One is a breast awareness, which means that the lady should be aware of signs and symptoms of breast cancer. You can easily read up on TheHealthSite.com all the signs and symptoms, and keep in mind and examine yourself by around the 5th to 6th day of the cycle, watching out for those symptoms. What the mind does not know, the eyes cannot see. So if you train your brain to look out for something, you can catch it much earlier. This is first. And the second is, if possible, every few years you can visit your family doctor or a gynecologist for a regular checkup or examination. And once a lady crosses 40 years of age, there are 3 guidelines. The first is the breast awareness, which I just mentioned. The second is a clinical examination by a doctor, which should be done yearly. And third is a mammography. Annual mammography is recommended. However, I would also want to add that please, it's a request not to do mammography on your own accord. It's always better if you hold a doctor in the loop and do it under a guideline of a doctor.
What about people who do not have easy access to a doctor, and they are in a remote part of the country and say medical facilities are far away? Yes. So what would you recommend in that case?
The single most important thing that we have seen which helps in reducing the number of deaths from breast cancer is reporting on time, and for this only an awareness and even an examination plays a lot of role. It is absolutely fine if they don't do a mammography, but it is not fine if they know that there is a sign or symptom of breast cancer and they sit at home or do something else for 2 months. So as long as they know what are the signs and symptoms and keep checking them regularly, that should be more than enough. No commercially advertised tests can replace your alertness. That is what we need.
At this point, I would like to bring in Ujwala. Ujwala, when was it that you first realized that something was wrong and you had to go to the doctor? Did you also perform a self-exam?
Breast cancer is not new to me. My mom got detected in 2000, and I have seen her, because of the late detection, we couldn't retrieve her. So I have seen her going out because of that. So that was registered in my mind. And so when I reached 40, I have asked my gynac to prescribe me a mammography, and so I got it detected at very, very early stage. The lump was not even ready for hands, so it was not even visible. No, not visible.
Yeah.
It was not, we were not able to touch it, or not able to find, not able to feel it. So that's how it all started.
Yeah.
It was that early. And luckily, I got the right doctors on time who would guided me to do an FNSC, and the doctor is sitting right here. So I'm very pleased to say that getting the right doctors in right time is very, very important.
So, doctor, what would you say to a person who, doesn't know that they have a lump, right? So, are there any factors that make certain groups of people or certain women more prone to cancer, and they should be more alert and proactively go get a mammogram done, or ask their doctor to prescribe one?
About 6 to 8% of breast cancers are supposed to be hereditary. The remaining are not. So only those segments which are hereditary or certain other factors fall in the high risk group, which would account for about 10% of all women, I would say. But the remaining 90% do not have any high risk factors, and they should follow the guidelines which I just mentioned some time back about the early detection.
And is there any particular group or caste in India that needs to be more proactively aware of breast cancer, or are at a higher risk for breast cancer?
No, as of now, we have not been able to identify groups, but now as more and more genetic testing is being done, we are slowly coming out, we are finding out that it is definitely predominant in certain groups as such, for whom high risk guidelines will be issued later.
What are the risk factors of breast cancer?
Some of the risk factors which I would like to mention is, one is age. With increasing age, the chances of developing breast cancer rises. Second is early menarche, where the period is starting early, say 9, 10, 11 years or something. It's not necessary, these are just the risk factors. The third is delayed first delivery beyond 30 years of age. Breastfeeding has a protective effect. Doesn't mean that not breastfeeding will increase the risk, but breastfeeding does have a protective effect. Then occasionally oral contraceptive pills which are used for contraception, they might contribute to the formation of breast cancer. There are many other factors we really don't know. There are, for example, the WHO report recently mentioned about some pesticides which contain estrogenic activity, which might be contributing to the incidence of breast cancer. What my message to you would be, whatever the risk factors, please understand that the 95% of women with breast cancer present with a painless lump in the breast. And because it is painless, many of them tend to sort of ignore it. So, of course, all painless lumps are not cancer. In fact, below 30 years of age, it is fibroids which are more common, and they never become cancerous. But the moment somebody crosses 30 years of age, and if there is a painless lump, all we would request is that you please take a medical attention. It's always safe that way.
Mostly women find it very difficult to approach a gynec, especially if it's a male gynec, and when it comes to their breasts, which they are usually not used to looking at or even touching, or and they find it difficult to address this issue. Since you have already done it, Ujwala, what is it that you can tell these women to help them make the first step and go approach a doctor?
I think the hesitation and the shyness part of it is always a limiting factor for women. I think Indian women have this habit of ignoring their healths. They will take care of the families very well, but not their healths. So I think the first move has to be in that fashion, that we have to love ourselves, and our body sends some alarms, and I think it's our own doctor on its own. So it's basically, we need to look at those factors and
be more in tune with yourself.
Yeah, exactly. Yeah. So I think the hesitation part of it should be ignored.
What are some of the most common symptoms that a person should watch out for?
Yes, I would like to enumerate a few of the commonest symptoms of breast cancer. As I mentioned, 95% of women present with a painless, hard lump or a knot in the breast. This is the most common symptom. Apart from this, sometimes there is a lumpish feel, where a clear-cut lump is not felt, but it feels that it is different from the corresponding area of the opposite side of the breast. Then the third is a blood or a blood-stained nipple discharge. The fourth one is there are changes in the texture over the skin, changes in the direction of the nipple, and of course there are knots or lumps in the armpit. By a knot or a lump, I mean something which is much harder than the surrounding breast tissue, which feels like probably a stone or something very firm.
If a person spots these symptoms and they go to a doctor, what is it that they can expect during a breast exam?
Correct. I would like to mention here that the doctor is likely to take a brief history of since when the symptoms and everything were there. There will be a bit of an interview followed by a clinical examination in the presence of a sister, where the doctor assesses the feel of the tumor, the lump or any other symptoms, and make a judgment to the next step. This is very important because what a normal person may feel may not be felt the same by the doctor. What a normal person may feel is normal may be felt abnormal by the doctor. So after the examination, we take the next step about the decision what to do next. I would also like to add that all lumps are absolutely not cancerous. In fact, it's the non-cancerous lumps which are more common in the younger age group below 30. As the age increases, the chances of a lump becoming cancerous increases. After 40, more than half the lumps will be cancerous. After 50, almost all. So what a doctor does is just feel and at least have a rough idea in the mind that am I dealing with a cancerous lump or it looks like a benign one.
So there you have it. Like Dr. Shah said, if you really care about yourself and you love yourself, then please don't forget to do a breast self-exam on the 5th or 6th day of your period. And also, if you find any change at all in the shape, size, texture of your breast or the nipples or the area under your armpits, go get yourself checked. And there's nothing to fear in a breast exam by a doctor. There will always be a nurse present and they're just looking from the medical point of view to see that everything is okay. Remember that early detection is the key to better treatment. So don't forget to hit like and to subscribe to more of such videos, and don't forget to share this with all the women you know. Thank you for watching.